psychologist here. So I'm here to say about autism and virtual autism. So virtual autism will be a new word for you. So I'll start with autism and then I'll move on to virtual autism. So what is autism is like, hope everybody will be knowing it. So it's a condition. So this word was coined in 1943, and when it was in that century, I mean in that time, it was like 1 in 10,000. Like it was very rare. So the scientist who was researching on autism could get only 11 kids to diagnose and study and all. But soon after this pandemic, when you take this current scenario, it is like 1 in 10. 1 in 10 kids is having autism. So why I choose this topic is like, in 1 in 10 kids, we cannot be so sure that it is purely ASD or virtual autism. So then how can we differentiate it? So there comes the cause and the age. So cause is like, for autism it is not yet finalized. Still the studies is going on. So we cannot say what is causing. For virtual autism, the cause is from the word itself, virtual. That is excessive screen exposure to the kids. So autism is like a condition. Even virtual autism is also a condition. We are not telling that it is a disorder, it is a disability, it doesn't come in there. It's a condition. Or like what we say, a behavioral condition or a sensorial condition. Likewise, a condition. It's characterized like that. Which in autism is like the American Psychiatric Society have defined autism as a developmental condition with lacking two main categories. That is social communication and repeated behaviors. In these repeated behaviors, there comes the hand flapping, restricted interests and all. So I'll explain on that as well. So social communication deficits may be like decrease in sharing interest or sharing toys, sharing playthings, sharing food or sharing the dress, or maybe initiation of a conversation, asking for their needs, requesting, all these things will be affected in the social communication. In restricted interests will be inflexibility of behavior, that is extreme difficulty in coping with the change. If the child is following a particular routine from morning till evening, that is morning after waking up, he'll be like brushing, then might be drinking milk, then will be going for toilet, taking bath and then having breakfast. But if somebody, the regular people who's not taking care, somebody else is taking care and the routine is changed, the child will obviously be cranky because they doesn't like change in routine. So that is restricted interests. In repeated behaviors, it is like hand flapping, tapping, showing all the stereotypic behaviors. That is interesting. So mainly it is categorized under social communication and repeated behaviors. So the main symptoms will be like, not only this, it will be like lack of eye contact, lack of sitting tolerance, self-play, no communication, no interaction, stereotypic behaviors, moving fingers in a particular way, maybe watching the fingers so close to the eyes, moving back and forth, dropping the objects and laughing. So all these will be there, but it will be different to different kids. Maybe some kids will be having all these features, some will be having very few. So when can we notice this? So for a child, the parent will be the first one to notice this. So before the age of 2 or 1, the parent should be able to notice some changes that my child is not like the other kids. So when you notice, that will be the initial start of treatment plan. As soon as you notice, you have to go to the, normally where people doesn't know, you will be going to the pediatrician. So they will be referring to the professional as we people, like we people. So when the early signs are being noticed at the year of age, that will be the early intervention for the kid. As soon as you observe, early intervention, I mean management can be started as early as possible. This symptoms, like if you didn't notice at the age of 1 or 2, it will continue because we are not providing any treatment or management options. So this will be continuing for 2nd year, 3rd year and 4th year. But for virtual autism, within the 3 years of span, if we could start or implement a management technique, that will be beneficial because there is a possibility that we can make them back into normal. But if it continue and it goes towards the age of 5 or crosses 4, it is difficult. Then they will be categorized into the criteria of ASD, Autism Spectrum Disorder. Okay, so So once you observe before the age of 1 or during the 1 to 2 years of age, what you have to do is like when the pediatrician suggests you to go for an assessment, go for a screening. Like we SLPs will go for a screening. That is, we will give you a set of questionnaires regarding the symptoms of the kids or the features that is being normally seen in the kids, where you have to tick or you have to say what you have observed in your kid. When it is done, and if we are making sure that okay, he is in risk of autism or he has some features, then we will move on to the detailed diagnosis. So in detailed diagnosis, we have some checklist telling like MCHAT, CARS and all, which we will be using it and specifying it that okay, the child is in the risk of autism. We have to start a treatment plan as early as possible. After the detailed assessment, in the detailed assessment, we also check for milestones as well, developmental milestones, speech as well as motor milestone. So in speech, what we ask is like when was the babbling sound? They will be making sounds in 6 to 8 months now. So when was that? Was it adequate? If it wasn't there, we will be mentioning the date. If it was adequate, it will be adequate only. But most of the kids know they will be normal till 1 year of age. Suddenly, like when 1 year of age, they should be able to utter one word. Mostly it will be like amma or nana. So if that wasn't there. So when, according to my experience, majority of the kids started saying amma after 2. So that was a delay, but the parents would be like, okay, they will take some time, might be. So you left it like that. So that was the first fault that you have done, leaving it that tight. When you started at one year of age only, like if you keep on stimulating, they would have grasped it. Then after this diagnosis, then the professionals will be giving you the treatment plan. As we do the goal setting and goal reviewing. What we are working on, we'll make you understand what is that, how to do at home, what is the response at home as well as here. So we will convey the same to you as well, along with diet plans. So diet plan is like, for every kid, sweets won't be triggering them. For some kids it will be fruits, some kids it will be some juices, like this. So here we had kids with a 3-year-old kid, a female kid. She will get hyper when she has banana, but not with sweets. So the diet plan changes according to the individual kid. So we have to find it out what is triggering the kid. Then we have to remove the particular food product from the diet. So it is like a diet plan depends upon the kid as well. We will normally say to avoid sweets, dairy products, biscuits and all, maida content things and all. But it might vary. So some can be with fruits, some can be with juice. We also had a kid who gets triggered with the watermelon juice also. So likewise, we have to, if the kid is okay in this time, and it's better not to introduce anything new, not to change anything in the routine as well as in the food. Okay, so regarding autism tips which I can give you is like, if you are not aware of what ASD is, learn as much as possible. Nowadays, like everything is available in the network, so you can search on it or you can go to a professional and ask regarding your doubts. Like if it is okay, if you are coming here only, you can ask anybody here regarding your concerns. Any of us will be there to help you. So that is like learn as much as possible. Then whatever the therapist say, follow the same thing at home without a break. Like if you take a break in between, the child is losing that continuity. So that consistency should be maintained. Then only the progress will also be there in the same this thing. And also, like, don't be panicked if something suddenly happens also. It is in the routine, routine. It might, like, ups and downs will be there, but it doesn't mean that it will be like going back and all. If you continue the same pattern and all, it will be fine. Moving on to virtual autism, it's like virtual autism. So virtual autism, as I told, it will be difficult to diagnose. So knowing whether the child's symptoms are due to autism or due to the screen exposure. So why we tell you to get it cleared before the 3 years, it is the critical period. Usually it will be like till 5 years we have prescribed before. But But nowadays, soon after the pandemic, every kid that I mentioned, 1 in 10 is having features of autism. Whether it is ASD or visual, we don't know, but still. But so for that, we will be like, before 3 years, if you could get the child to us, there will be the early intervention plan and we can get back the child to normal. But once the 3 years is done, what happens there is the brain development is already happening along with the age progress. So once the brain development is done, inputting something new into the child will be difficult. So what we have to do is, along with the development, input whatever changes we wanted to make in the child. Then it will be growing along with the age. So that is why 3 years is like the critical age. Okay. Now I would like to tell an example regarding. Now the kids are like easily accessing the Androids or phones or TV because they are.
Okay, let him sit.
So how they are learning that? Because we are showing them. Because if you are providing the tab on the TV, the way you on it, the way you swipe it, the way you skip the ad, from each and everything, the child is learning through that. Thank you. So the way they learn the androids, the same thing can be implemented in learning speech tests. So before in young age, the childhood times, how you have learned. It's like the father or the grandparents or the parents will be feeding the child by showing the birds or animals or vehicles around or the things at home or something. That the technology wasn't there much in our time. So that time the child is giving an eye contact, learning how the lips is moving, how the tongue and all is moving to produce the sounds. So that is making the child to acquire the sounds and then we are producing it. But nowadays, to make them eat, we are providing the tablets or the phones. So where the child is, what is happening with the child, they are completely into that world. They are not understanding that we have to communicate in this world, that convey their needs. So what they are getting is like only auditory and visual simulation is getting. Something they are hearing, something they are seeing, that is only going into the brain. Other than that, in the world, they are not having any idea that we have to talk to communicate or to satisfy our needs. So that is the example means. So before we used to give visual, auditory, eye contact, everything comes in that. But nowadays, this is only in this small cubicle box or the square box. And also studies have revealed that increased screen time is increasing a melanopsin neurons and decreasing in neurotransmitters, which is delaying the cognitive and language development as well. So it is like impacting us physically, internally also. Not like inside neurotransmitters and neurons are also getting affected. That is leading to the cognitive and language delay as well. But still the cause is not found out, but it's telling that these have been reduced. So if the child is having autism related features and the screen exposure is there more, then it will be diagnosed as visual autism nowadays. So whatever assessments we are getting nowadays is like the screen exposure is more. Because of the pandemic time and work from home, parents doesn't have any other option. So they had to take care of the child and nobody else from the outside were allowed also because of isolation. So that time it just automatically happened. It's not like the parents' fault also. But once in a day, at least if you could spend a small time or like 1 hour or more, if you could spend with the child, then that simulation is more than enough because they are getting an idea that we have to communicate here like this, other than the screen. So that can be implemented as a technique. And also if you suddenly take away the androids or the screen from them, that will be making them more hyper. So the behavioral issue starts. Then will be like they might not be able to sleep, interactions won't be there, they might show their tantrums. And also they doesn't know to communicate. So that also triggers them to show the behavioral issues. Because if they want something, they wanted to say that I want that, but they doesn't know what how to say that. So instead of that, they'll be showing the tantrums, like throwing the things, beating themselves or hurting themselves or biting the others, etc. So that are all is because they doesn't have the speech. That is it. So if you can improve the speech by stimulating more at home, it will be reducing the behavioral as well as issues related to that. And along with that, the professional rehabilitation process also, if you continue, that will be more. Because here only 45 minutes will be taking them. So rest of the majority of the time, the child is with the parents or grandparents. And along with that, I would like to suggest that focus on one language at home. Like if you want the child to be Hindi, talking in Hindi and Telugu, focus the same at therapy sessions along with home as well. Some families might be having like the parents wanted the child to be in English, but the grandparents doesn't know English. There it becomes a confusion. So what you have to do is like when the grandparents are talking, you also go sit and translate and then make them understand. If you introduce two languages at a time, that might make them confused because they doesn't know what to say and what to use. So rather than that, focus on one particular language. And some questions which was received by this, I did the same topic for a webinar, and the questions received was, will virtual autism be reversible? Yes, if it is early identified and intervention is started, it can be reversible. All these features can be reduced and the child can be normal. Along with reduction of, not reduction, avoidance of screen exposure. It can be back to normal. So how can you do it? So the management option will, the first one will be stop all the screens. But sudden stopping of the screen will trigger, as I've already mentioned. So what you have to do is, if a child is having 8 hours of screen exposure, reduce it to 6, 4, 2 and then stop it. While reducing this also, you can introduce a routine plan for the kid. A routine plan like you can arrange a particular activity timetable for the kid. That is morning if they are getting up, if they wanted the phone, okay, that particular time will be the phone usage time. Then you have to do a craft activity or a painting activity or swimming or music or something. Any other co-curricular activity you can introduce into their timetable and make them follow the same. So there they are getting engaged where they will forget the use of this because they are getting interest in some other things. We are making them to do that. So that will also help them to reduce the screen usage as well as improve the speech also because they are getting interactions somewhere else. Next is like interact more. Interact more is like at home if you are working or if you have work from home also. In between if the child is coming, just 5 or 10 minutes if you can talk, that will be more. Then or else in between the work or after the work, if you could spend an hour continuously with the child. Not to forcefully make them work, write and all, but just talk. To improve the speech, just talking will be more beneficial for them. And also if you can take them to a park or a group, like if you have a friends community in the society or the apartments or something, if you can take your child to the friends, kids or something, they are being introduced into a group where they'll automatically develop a interaction. Due to the COVID time, this interaction wasn't happening in many of the kids. So now it is like almost settled down. So if you can introduce them to a group, At least the other kids will make them mingle. They will call them for playing activity and all. For example, if you take them to a park, they will be standing simply without knowing like what to do. So the kids, like if you can introduce some kids to them, they will be holding, grabbing them to go to the slide or swing or anything. So suppose if it is a slide, they will be following the same routine what the other kid is also doing. So they'll be walking along with them. They'll be following, climbing the stairs, sliding, again coming back because the other child is also doing. In between, the conversation automatically builds up. So that is like once it is already there, visual autism is there. So how can we prevent it? Is like encourage physical outdoor activities, as I've mentioned. Not only park or swimming or anything, or just the father and the kid can play a football or basketball, introducing the sports items into their life. It will also reduce the OT related issues as well. Because in OT also we provide physical activities. Ball compression and all we give to reduce the hyperactivity and to make them calm. The sports thing also will reduce the hyperactivity and make them calm. So we have to just push them for initially, then they will automatically get adapted to that. And also if the routine is like before bedtime they wanted screen time or during feeding they wanted screen time, try to reduce that time. So if you are eating time, if you are showing the screen, it will be better to avoid. Why? Because you can describe the food that you are giving. Like if it is a breakfast, you can tell that this is breakfast that you eat in the morning and what you are eating. Like upma, idli or something. Make them describe the thing. You can describe first, then let them also, like you can ask questions, WH questions related to the thing that you provided and let them answer it. So that will be like more stimulation in an advanced level, not like in the naming level, in an answering level. And also avoiding screens not only to the child, if you can also avoid, that will be better. Because if you use the phone in front of the kid, they will also be peeping into it. So when you spend the time with the kid, try not to use it. And also some kids will be getting addicted or attracted to the background noise from the thing that they are watching. It can be horror movies or fight movies or violence or anything. That should not be there. If you're watching together for a particular time, as I've mentioned, only this much time you have to watch. So with the family, if you're watching, put something like calm or melodious music or something which suits them, not making them hyper or triggering or getting excited. So we don't know what is making them excited, and so that time only they will show the stereotypic behaviors. So that should not be there. So it's always prefer shows with natural background and muted color tones. Avoid violent shows, dubbed shows, addictive video games. Dubbed shows, why we tell to avoid dubbed shows is like they are imitating what they are seeing. So if dubbing like in a high frequency like mono act, not mono act, mimicry sort of a thing, if we are doing, they will also imitate the same, which can cause voice problems as well. So voice problem is like straining the vocal cords here, then the sound also will be going. So not to make them imitate something. So it's like, so if the normal conversational things are happening, it will be good. Like a nice movie and all, you can watch with them. And also if you can watch something with a good content line, with a moral something. Suppose you are watching a story, you can explain what is happening in the TV or screen. Then you can ask questions on that and make them understand what the moral was. Like good social stories, if you implement, they will also be getting a understanding of what the story is or what we have to do, or good manners and all. So likewise they are getting all that. Last but not the least, it's like for babies under the age of 2 years, no screen time. Like we will be showing to make them like as an interesting thing, like the colors will be there, moving sorts of things will be there, sounds will be there, but that is going to damage them because every time when they cry, they will be shown with this to make them calm. So this will be like making them addiction to that. So it should not be done. Thank you. Any doubts regarding this?
Yeah, I want to ask one thing. How to know which food is triggering the child? Like sweet or what you said, like
Yeah.
maybe many options. So how to recognize like what is the main reason behind it?
So if for your child, do you think that she is becoming hyper after eating food?
So I have not observed like that before.
Okay. So whatever meal plan you're planning, giving now is best for him because it's not triggering him. Suppose if you introduce something like one at a time, if you wanted to see whether it is triggering or not. For an example, if you wanted to introduce, if you are not providing chicken to the child, and you wanted to see what happens, if you are providing, if you are trying, going for a try, introduce one at a time. So provide a little bit and see how he is. For some kids, it will be like triggering very fast. For some, it will take some time. So give a little, wait for some time, and then see. If you provide 2 items or something, we cannot differentiate how it is. Like, so if you wanted to introduce something new, see whether it is doing any harm to the child.
If they are continuously saying that I want more, then we can observe when he's triggering or something.
No, if you like suddenly if no changes like hyperactivity is what like ma'am, they will be standing and they will be laughing suddenly or moving their hands like this or jumping around, running around like that. So that sort of activities is being observed soon after reaching this or a little while after reaching this, then it should be stopped. Even though if they ask for more also, you should say that your tummy will be damaged or you will get an ache in tummy, so you should not eat. Make them understand that you will get a boo-boo or something in their language, which they can understand, try to avoid it. But if nothing is happening, then we can introduce it again. With the quality you can do it.
So as you told that until 5 years there will be a chance for reversal of everything. So once the child crosses 5, what are the chances to reverse?
Because it linked to the normal criteria. So, sir, as I've already told, in the brain development time is like 0 to 5. That time, already the child's, the normal speech thing, language, cognition, everything in the 5 years will be adequate. Because the brain is developing that time. After the developing is like we are learning. So, it is not inquisitive, it is not built up inside. So, we have to input. So in this 5 years of time, whatever we want the child to be normal and we wanted the behavior to be reduced and they have to be like behaving proper in the society. So we have to introduce that within 5 years. After 5 years, if we are implementing also, we are depending upon the severity of the features that they have. If it is in mild condition, definitely we can make them back. But if the condition is in moderate to severe level, it will be like we cannot assure that they will be normal, but we can reduce the severity. That I can assure. Like if they are very severe and they will a profound level of hyperactivity, when you give the rehabilitation process, start the process, the severity will be reduced. But we cannot say that. We cannot say that it can be normal. Because autism is like normally no cure for it. The severity can be reduced. Within this 5 years of age, and if it is mild, definitely we can. Even after 5 also, mild can be tried, like, depending upon the child also, the input that the child puts in. That is the main factor in this. So mild can be treated, but not with the moderate severe cases.
So you are telling about behavior therapy?
No, regarding everything.
Regarding
In speech-wise also, if the child, like in 5 years of age, the child should be able to say complex sentences. Like the balloon is placed fixed on the wall with plasters or double-sided tape. Likewise, the sentences should be there. Seeing the thing. That will be difficult for them. So as much like how much ever we put, the child will be able to combine 3 words, some like I want water, that will be the level. But if the child is eagerly observing and learning and all, then it will be good. That is what I told, it depends upon the child also. If the child is putting more input, then we can. Not to this level, but they can communicate in a normal way. The complex way will be difficult for them.